So thank you very much for inviting me to talk. I think the lights and the cameras and the number of people make me particularly nervous. I have talked in front of large groups before, but I think just every time when it becomes more formal, I'm very good at talking informally to people. People who've heard me talk before. When it comes a little bit more formal, it makes me a little bit more nervous. So if I and ah and stuff like that, just bear with me. As I talk a little bit more, I'll ease off and I'll relax and it'll be a little bit more enjoyable and able to listen to. So when they asked me to speak, we were trying to think of what topic to do, and stroke is my particular interest in rehab. So then I was thinking what specifically to talk about, and so what I decided is I'm going to talk about the stroke continuum. So I'm going to talk about a little bit about everything right from the beginning of what causes a stroke, right through to rehab, right through to kind of returning to normal life, kind of like getting back driving and traveling, and the common questions that people ask me. So by doing this way, I'm not an expert in one topic. I'm doing a whole bunch of little things, so that's the way to confuse people. So I sound like I know what I'm talking about. So what we're going to talk about is we're going to identify what a stroke is by understanding risk factors. Hopefully you guys will be able to reduce your risk of having a stroke. Identify what treatment exists for strokes and which ones are effective. And then to better understand how and why rehab plays a key role in stroke recovery. So this is the outline. So beginning, we're going to talk about causes and risk factors. And those who have come to Shaver before and heard about risk factors have probably heard a lot of this, but you can never hear risk factors enough. We're talking about treatment. We're going to talk about TPA and a little bit about acute care treatment. We're going to talk about rehabilitation, the evidence behind it. We're going to talk about a little bit about alternative therapies, things that are out there like hyperbaric oxygen and acupuncture and Tai Chi, etc. And then we're going to talk a little bit about medical management, just so it feels like medical part is still important in rehab. And then we're going to talk about getting on with your life, as I talked about driving, traveling, and some of those things. Okay, causes and risk factors. And I said, if this is review, great. But this is our biggest impact in trying to reduce chances of people having a stroke. Okay, so these are the common stroke statistics. Third leading cause of death behind cancer and heart disease. Second most frequent cause of disability. So disability is when you can't do something. So you can't walk, or you can't get dressed, or you can't drive a car in particular. Arthritis is the #1 cause of disability. There's about 1 stroke every 10 minutes, if you look in Canada. So it's about 50,000 strokes per year in Canada. About 14,000 people, Canadians, die per year. And most of these are women, probably because women are older at the time of having the stroke, so they're more likely to have more medical problems, and that's why more women are dying. Men have women to look after them a lot of times. That's why men don't die as much from the strokes. 300,000 people living across Canada with the effects of a stroke, and about $3.6 billion it costs per year for stroke care. I think that's everything from acute care to rehab to probably home care to whatever else is out there looking after people with strokes. So it's pretty costly, and it's going up. I think the number ahead was 2.8, and it just keeps changing, keeps growing. So we know about the healthcare system and how much it costs for everything. Okay, what is a stroke? First of all, that's an MRI, and that is not a stroke. Okay, that is a normal-looking brain, but you guys wouldn't know the difference anyway, so I just put the picture up there. A sudden loss of brain function with an interruption of blood flow to the brain. Okay, so blood not getting to the brain, that's what happens in the stroke. It's the same thing idea as a heart attack. It's just that blood doesn't get to the heart. So a stroke and a heart attack are very similar, just different organs are being affected. Okay, common signs and symptoms. Headaches, dizziness, vision problems, trouble speaking, weakness, loss of sensation, disorientation, person not sure who they are, or maybe what date it is, or where they live. So the common types of strokes, there's 2 types. There's ischemic and hemorrhagic. So the majority, as you can see, 80% are ischemic strokes. And that would be what's classified as thrombotic or a blood clot. Okay, then there's embolic strokes, which is still a blood clot, but often it'll travel from somewhere. So if someone has an irregular heartbeat, they might develop a blood clot in the heart, and then that'll travel up to the brain. Okay, so it's still ischemic stroke, but it's the idea that it's from the heart, that the blood clot came from somewhere else. Hemorrhagic strokes, 20%. So some of the common causes, so someone has high blood pressure. Amyloidosis is an abnormal protein that gets deposited into various organs and blood vessels. It makes the blood vessels very weak, and they can bleed. Often you see someone older. So actually amyloidosis is one of the most popular causes now for bleeding, and there's not much you can do about it for treatment-wise. Sometimes they've talked about vitamin B6, etc., trying to treat it, but basically there's not a lot you can do for treatment for amyloidosis. An aneurysm, so if you have a thinning of a blood vessel wall and it breaks, you get bleeding from that. Or what's called an arteriovenous malformation, which is the arteries and veins joined together, and it's an abnormal formation basically, and you can bleed. Sometimes you can do surgery for this, and sometimes, unfortunately, depending where it is in the brain, you can't do anything about it. One thing with hemorrhagic strokes is a greater mortality. So of people who have a bleeding stroke, I think sometimes it could be up to 80% of those people will die because of a bleeding stroke. Versus an ischemic stroke, there's not the fatality that you'll see with that. Differential diagnosis. So this is what else mimics the symptoms of a stroke. So if someone presents to the emergency department, the doctors are thinking of stroke, but what else could it be? These aren't in order of importance or the prevalence of them. They just came to the top of my head when I was writing, or when I was looking at writing these down. So migraine headache sometimes can look like a stroke. Nerve compression, so if a nerve is being pinched in your neck, sometimes people can have numbness in an arm. The person might think I'm having a stroke, but it might just be a nerve pinched. Anxiety and stress. Some people can get very, as I say, worked up, and that can look like a stroke as well. Brain tumor, same thing. It can put pressure on different nerves, and it looks like a stroke until they do further investigations. Hypoglycemia, so if someone has low blood sugars, anyone who's diabetic, if your sugars go low, sometimes people actually feel like they're having a stroke. Inner ear infection, so just an inner ear problem, basically, sometimes it can affect your balance. I think the idea is just to show you that other things can cause problems, and so when someone's having a stroke, they don't know they're having a stroke. They might think, oh, it's just an ear infection, or oh, I'm just a little bit anxious today. And a lot of people will wait to go to the hospital until they actually, before they wait to see if they've had a stroke. And as we talk a little bit more about treatment, it's important if you do have symptoms to go to the hospital as soon as possible. Or at least call 911, actually. That's more important than going to the hospital. So risk factors. So these are events, circumstances, life choices that increase the chance of developing an illness. Okay, so there's a number of risk factors. We're not going to read them all. The major thing is to divide it into controllable and uncontrollable. Okay, so the uncontrollable, you can't do anything about it. Okay, it's the way God made you, and that's what you can do. The controllable one means you can do something about it. You can take medication for it. You can stop a certain behavior. And we're going to talk about these things very quickly, because that's not what the whole talk is about. And again, if you have any questions, write them down, and at the end we can maybe go over some of the questions, if they're good questions, if I know the answer. Okay, so uncontrollable risk factors. So being male is a risk factor right off the bat, and you can't do anything about that. Age. Most strokes occur after the age of 65, and that's purely because as we get older, we're more likely to have problems. So if we have high blood pressure or diabetes, it's just more years living with the effects of that particular illness, and that's why as we get older, we're more likely to have a stroke. Family history. So a blood relative, having heart disease less than 55, or having a stroke before 65. Okay, so that's just general numbers looking at that. Ethnicity or race, African American, Hispanic, Aboriginal. Certain ethnic groups are more likely to have other medical problems, like blood pressure problems or diabetes, and that's why they're particularly at greater risk of having a stroke. This is versus Caucasian individuals. And if you've had a previous stroke, which is a common question people ask, is what are my chances of having a second stroke? There's different numbers all over the place from people having, what people say. I put down 20% of people having another event in 2 years. Some people say 5% per year, or about 25% over 5 years. That doesn't mean 20% of the people who've had a stroke in this room are going to have another stroke. A lot of it depends on, do you look after yourself? Do you look after those risk factors? Do you look after your diabetes? Do you look after your blood sugars? But it can unfortunately happen again. So controllable risk factors, so factors that can be changed, modified, or treated. And you can actually reduce your risk of having a stroke. And what is the number one controllable risk factor? Those who have heard my talk before, if you guys listened, what's the number one controllable risk factor? Anybody shout it out? How about high blood pressure? Good one. Okay. So high blood pressure is one of those problems that people have, you have no idea. Half of people are, say, asymptomatic. You don't know you have it until maybe you go to the doctor. By definition, high blood pressure is your top number being greater than 140 or your bottom number being greater than 90. Not just one reading, probably after a number of readings, maybe at the doctor or the nurses or whatever. And just to show the importance of getting your blood pressure improved, if you can reduce your top number by about 10 beats or 10 points, you can reduce your risk of having another stroke by about almost 40%, which is pretty significant when you look at medications. A lot of medications, maybe only 25% reduction in having an event. If you have diabetes, often your blood pressure needs to even be better. Sometimes less than 130/80, 125/75. And that's just because diabetes is a risk factor in itself. And so you want to do everything you can to reduce your risk of having another stroke. So treatment of blood pressure. You always look at more conservative means, so exercise, trying to lose weight, and then medication. And there's a lot of different medications for blood pressure. We're not going to talk about them here. Just the bottom line is if you have high blood pressure, you want to get it down. So whatever medication that the doctor's going to put you on, as long as your blood pressure is reduced, that's the most important thing. Smoking. So increased risk of stroke, heart disease, cancer, respiratory disease. 90% of lung cancers and lung diseases are attributed to smoking. 30% of all cancers are attributed to smoking. They say it's more addictive than cocaine, heroin, and alcohol. Never doing any of these things. I couldn't tell you for sure for personal example, but that's what everyone says. Cost-wise, this probably could be more now, but if someone smokes a package of cigarettes a day, it's about $2,500 per year. Now, I guess it depends where you get your cigarettes from, maybe how much it really costs. But it's costly. You think you could do a lot with $2,500. In 2008, 18% of Canadians 15 or older were still smoking, which is down from previous years. I think even the years it's down about 1 or 2% per year for the last few years. So people are hopefully getting the message to stop smoking. And smoking is responsible about 14.5 or 15% of all heart disease and stroke deaths. So stopping. You're never too old to or too late to stop smoking. So this is again more numbers. After 1 year, the risk of dying from heart disease is reduced by about 50%, which again is quite significant for just 1 year. After 10 years, the risk of dying from lung cancer is reduced by 50%. And after 15 years, the risk of dying approaches that of a non-smoker. So whenever you're doing a history and you ask, do you smoke? The person said, yeah, I smoke, but it's been 30 years. I mean, it's important as an indication that the person did smoke, but as a risk factor, you don't really attribute that to anything. So it's still important that whether you smoke for 10 years, 20 years, 50 years, the numbers still work, that it's important to stop smoking. And the idea of trying to stop smoking, different approaches. Cold turkey idea to stopping, nicotine gum, nicotine patches. Some people use acupuncture, hypnosis, medications. And the bottom line with trying to stop, it's really the person wants to stop smoking. You have to want to stop smoking. If a person doesn't want to stop, doesn't matter what patch you put on them or what medication you give them, it's not going to work. Alcohol, it's more of a binge drinking is more of a problem. People drink a lot, particularly after a stroke. It increases the fat in their blood, causes weight gain, and that increases your risk of having a stroke. Some medications, if you're on warfarin, alcohol makes your blood even thinner. So often if you drink alcohol, the doctor may have to adjust your warfarin, or they may suggest not drinking. And beneficial, there's some evidence maybe that red wine, maybe even grape juice, may be beneficial for preventing heart disease and stroke with what's called flavonoids. So if you don't drink, I don't think there's enough evidence to say stop drinking, but grape juice might be beneficial. Unless you're diabetic, don't drink grape juice. It's the highest sugar in all juices, so don't drink that. So then you have to do something else. Okay, dyslipidemia. So if you have high cholesterol, there's good cholesterol and bad cholesterol. So HDL is your good and LDL is your bad. You need cholesterol for normal cell function, for your body to work. We know that abnormal cholesterol increases plaque formation in the arteries. And there's a greater link with increased cholesterol in heart disease than there is actually with stroke. But if your cholesterol is high, doctors are still going to try to get it down. So same idea with treatment-wise, you're going to try conservative measures. You're going to try to change your diet. You might try to lose a little bit of weight. And if that's not working, then often medication. A lot of people will be on statins, or like Lipitor or Crestor or ezetimibe, basically, or medications that sometimes are used for lowering cholesterol. Diabetes, blood sugars between 4 and 7. There's a test called glycosylated hemoglobin, or hemoglobin A1C. And that's kind of a control of your blood sugars over the last 3 months. And that test should be about less than 7%. These are like the gold standards for controlling your blood sugars. Heart disease, so if a person's had a heart attack, congestive heart failure, a risk factor for stroke. Overweight, so high blood pressure, diabetes can be associated with being overweight. Waist circumference is a big thing. So if you're male, if your waist is greater than 40 inches or female greater than 35 inches, includes your increased risk. We're not going to measure anybody's waist today.